All right, good evening, everyone. My name is Derek Doherty, and I'm a person in long-term recovery from substance use disorder, and I will be your MC for the second session of the Reno County Collaborative's Community Conversation. I'd just like to start out by asking how many of you were here for our first session? Please stand up. For our first session. That's amazing, that's amazing. Thank you so much for coming back. For those of you that are new, thank you for getting on the bus with us. Please notice the screen behind me and take this opportunity throughout the evening to go to the website www.menti.com. Please use the code 863-44149 and respond to the question, what do you feel holds people back from getting help with substance misuse? For those of you that weren't with us last month, we focused on personal stories from several of our panelists on substance use disorder and how it affected them and their families. Tonight we move to engagement, and we are excited to introduce our esteemed group of panelists to share their stories and experiences. Please join me in welcoming Jason Griever, Anna Woodburn, Officer Trevor Nobbs, Heath Beekler, Judge McCarville, and Maddie Bennett. Thank you guys for coming out. We'd like to begin this evening with Jason Griever as he gives us a presentation on structural stigma defined.
Thank you very much. I watched the video from the last one. I wasn't able to be here, but I watched the video and I noticed that for the short people, the microphone looked really tall. And so I'm going to adjust that just a little bit for the video. So my name is Jason Griever, and I'm a social worker and an addictions counselor. I'm the Vice President of Operations for the Western Division for MIRROR. And as someone who works in the field of substance use disorders and behavioral health care, then I want to say I really appreciate all of you being here tonight. And as a family member and a friend and a coworker to individuals experiencing substance use disorders, I am inspired that you're here tonight. And as a person in long-term recovery from a substance use disorder, I'm grateful that you're all here tonight. The American Society of Addiction Medicine defines addiction as a treatable chronic medical disease involving complex interaction among brain circuits, genetics, the environment, and an individual's life experiences. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful consequences. Prevention efforts and treatment approaches for addiction are generally as successful as those for other chronic conditions. So when we think about substance misuse and substance use disorders, if you're looking for a parallel in the biomedical community, then you can look at conditions like asthma or conditions like diabetes that are chronic, recurring conditions. I'll tell you a quick story. A couple of weeks ago, I went to St. Louis with my girlfriend and her family, and we all wore red shirts that said, in this family, we don't battle alone. I love someone with endocrine cancer. And it was good that we did that. It was good that we did that because it showed the support that we had for our loved one who was experiencing cancer at that time. And it was good because we were sending a message about the health care that she received and about the condition that she had, normalizing the fact that she was experiencing cancer, and that while she was experiencing that condition, we were showing her our love and our support. And I'm thinking back to the 7 times that I went through treatment, and I don't recall anyone ever wearing a shirt that said, in this family, we don't battle substance use disorders alone. I love someone with a substance use disorder. And part of that is because of the systems of discrimination, or the systems of stigma that exist in healthcare, in employment, in social services surrounding substance use disorders and substance misuse, and we call that structural stigma. Substance use disorders is one of the most stigmatized conditions on earth, despite the fact that over 20.3 million people in the United States struggle with substance misuse. Nearly half of Americans don't think that addiction is a disease. In 2018, only 18% of people aged 12 and over in need of substance use treatment received the treatment and care that they needed. In a recent study, 48% of individuals in need of treatment who did not seek or receive it cited treatment cost as a reason for not receiving care. 16% of individuals with substance use disorders did not seek treatment because they worried that it would have a negative impact on their employment. And approximately 15% felt it would impact their community's view of them. This kind of stigma leads to discrimination in healthcare, criminal justice, employment, child custody, and housing, especially in rural communities where treatment and recovery resources may be scarce. As Seth talked about last month when this was presented, there are three different types of stigma. There is self-stigma, and that's the internalization of the stigma that surrounds us. There's public stigma, and that's the negative attitudes and beliefs that people hold towards an individual with a particular condition. In this case, substance use disorder. And then there's structural stigma. And structural stigma defined by the researchers who have only begun researching structural stigma surrounding substance use disorders, define it as a societal level conditions, cultural norms, and institutional practices that constrain the opportunities, resources, and well-being for individuals with substance use disorders. And we see that stigma manifest in healthcare, in substance use treatment, in mental health treatment, behavioral health care treatment, in criminal justice, employment, and social service programs. When we look at structural stigma in healthcare, the attitudes and beliefs of healthcare providers impact the quality of care that they provide and the willingness that an individual has to access that care. There are times when an individual will seek medical care in a hospital setting or in a primary care setting and will go in and experience being blamed for their condition. Now, imagine this. Imagine having chest pain and you go into the emergency department and someone is blaming you for your chest pain. Maybe they're saying, you shouldn't eat so many country fried steaks. You need to change your diet and exercise more. And then they say, here, I'm going to give you a couple of phone numbers for a cardiologist in the cath lab. Call them when you leave. And then they're given a couple of aspirin. Only if you, as a person experiencing the chest pain, agree to call a cardiologist after you leave. And then, should you go into cardiac arrest while you're in the emergency department experiencing those chest pains, then you're discharged from the emergency department for presenting with the very signs and symptoms of the condition that brought you into the emergency department that day. And those are some of the experiences that individuals with substance use disorders experience when they receive health care. There are financial disparities in the healthcare settings. A lack of funding for research and treatment exists when compared to other conditions, despite evidence that there's a comparable return on that sort of research and in the outcomes. There are low reimbursement rates for substance use treatment, which reduces the number of providers that there are, the number of individuals willing to provide substance use services. In 2008, the Mental Health Parity and Addiction Equity Act was passed. It wasn't until 2008 when they began to recognize that treating mental health and treating addiction should be on par with treating other biomedical conditions. And that Mental Health and Addictions Parity Act required insurance companies or prevented insurance companies from creating less favorable benefits for individuals experiencing behavioral health care conditions or mental health conditions as opposed to physical conditions. In 2010, the Affordable Care Act was passed just 11 years ago, and that outlined that health insurance companies could not prevent someone from receiving insurance because they had a substance use disorder or a mental health condition or other pre-existing conditions. Structural stigma impacts the quality of care in healthcare settings. There's limited access to begin with to behavioral health care. There's a reduced availability of evidence-based treatments for those receiving behavioral health care treatment. And there are minimal quality measures in behavioral health care settings to monitor what goes on in substance use and mental health treatment. 10 years ago, when I entered the field, when we had someone come into treatment, then we get about 45 days to work with them in a residential treatment setting. And then they would get 90 days in a reintegration program, giving them about 4.5 months in a residential treatment setting. And at the time we thought, that's still pretty low, because research says the longer someone is in a residential treatment setting, the more successful their outcomes with maintaining abstinence long term. Over the last 10 years, the reimbursement schedule and the way insurance companies work in the SUD field, oftentimes we get 48 hours to treat someone before we have to provide an update to the insurance company, proving that it's medically necessary for them to have treatment beyond 48 hours. Pharmacotherapy, medication-assisted treatment, like methadone clinics, they were established in the 1970s. Still today, in order for an individual to receive methadone, then they have to go stand in line and wait on a daily dose of the medication to treat their disorder. Imagine again if you're an individual with a heart condition, you're told that each day you need to go to the pharmacy and pick up your one pill, take it and return the next day to get your next. On the weekends, if you're trusted, you'll get 2 pills. Suboxone, buprenorphine, has been shown to have extraordinary results in treating opioid use disorders. Yet we have really, really complex requirements for prescribers to be able to prescribe those medications. And then the reimbursement rates for those prescribing Suboxone are very low. The costs of medication-assisted treatment are prohibitive to some people, impairing their ability to receive that type of care. Abstinence-based treatment programs often will discharge someone from the treatment setting because the individual has used a substance while in treatment. It's like being kicked out of the cardiac unit because you experienced cardiac arrest. This is structural stigma in the healthcare settings and in treatment settings, and it goes beyond those settings into the criminal justice system. In 1971, Richard Nixon announced the war on drugs. And then in the 80s, Ronald Reagan lit a fire under it, and then George Bush really took the mantle with it. And all kinds of policies were passed at that time criminalizing drug use, stiffer penalties for drug offenders. And what's resulted is a mass incarceration of individuals with substance use disorders. At this time, 65% of individuals incarcerated in the United States meet the diagnostic criteria for a substance use disorder. So we have a very punitive structural approach to combating addiction. Workplace structural stigma. In the workplace, there are policies that exclude individuals with substance use disorders from being employed. When I was an undergraduate student at a college here in Kansas, I decided that I was going to get a job at the Memorial Union and that I was going to be a greeter. And I was doing well in college. I was a model college student, got along well with my teachers and my peers, and was interviewed for the position and got the position, and a week later was called by Human Resources and was told, you can't work for this university because of your history with substance use. And I had to go through an appeals process with the university in order to work a minimum wage job, greeting people and telling them where the bathrooms were in the student union. Housing programs discriminate against individuals with substance use disorders by not giving leases to individuals with substance use histories. Other social service programs, domestic violence shelters, and some domestic violence shelters will not let a woman into their shelter who has experienced intimate partner violence if she is using substances. Homeless shelters have the same prohibitions. Food assistance programs. Folks can be denied supplemental nutrition assistance programs because of their substance use. That is structural stigma. The laws and the policies and the practices of institutions and organizations and the government that make it difficult for individuals with substance use disorders to thrive. The consequences of that structural stigma include a lack of parity in insurance coverage for the treatment of addiction, inadequate funding of public programs for treatment for uninsured or underinsured individuals, lack of funding for harm reduction programs, incarceration instead of treatment for people with substance use disorders, and lack of treatment within correctional facilities, leading to cycles of reincarceration. Creates employment barriers, it creates housing barriers, and it creates barriers to accessing needed social services. So what do we do? How do we combat structural stigma? We have to target the places where structural stigma is occurring. We need to talk to legislators, to institutions, to policymakers, to employers, to landlords, and advocate for individuals with substance use disorders to have these barriers removed. We need changes to our laws in healthcare, insurance. We need to stop over-incarcerating individuals with substance use disorders. We need to have changes to our organizational policies in our workplaces, in our schools, in our housing sector, in our social service agencies. We need professional education for healthcare providers, policymakers, and legislators. And we need advocacy. We need advocacy by people like you to advocate to change the laws, policies, and practices that marginalize, disenfranchise, and stigmatize individuals with substance use disorders. I'll leave you with this. My boss is here, and he warned me not to tell too many stories, but I'll tell one more story. When I was in high school, I had a friend, his name was Jason also, and Jason was in a car wreck. And it was a very bad car wreck, and he was life-flighted away from our town and put into a hospital, and he was on life support. And immediately, all around town, in gas stations, jars began to go up to help pay for medical expenses for his family to be able to go to the hospital. The school that we went to created a fundraiser for him and for his family. His family became local heroes, celebrities. Folks from church brought over covered dishes so that they wouldn't have to worry about cooking and they could focus on healing and visiting their family member. And Jason eventually died, and the community came together for his funeral services. And there was a huge outpouring of community support for his family. Hundreds and hundreds of people who didn't know him attended his funeral. And I've been in Hutchinson a few times in recent days. I live in Newton, but I've been over here for a few different reasons. And I've been into the gas stations and I've been into the grocery stores, and I haven't seen cans for any of the 35 people who experienced an overdose in the last 30 days in Reno County. I didn't see fundraisers for the families of the 3 individuals who died in the last 30 days from overdose in Reno County. But it's exciting to me, and it's encouraging to me, and it's inspiring to me that people like you are here this evening, because you are the voices that can bring about the changes to the public stigma, to that internalized stigma that people with substance use disorders experience, and to the structural stigma and the barriers that individuals face to accessing quality behavioral health care, quality health care, education, employment, and housing. Thank you very much.
Thank you, Jason. That was an eye-opening presentation on structural stigma, and I really like how you presented some of our issues, but then also presented that some of the solutions are what we're doing here tonight, and getting involved in things like the Reno County Collaborative. Up next, we have Anna Woodburn with her experiences with stigma.
I'm probably going to look at my paper a lot more than Jason did, just so you guys know. Also, my name's Anna, by the way. And I am a person in long-term recovery. What that means to me is I haven't used any drugs or alcohol since July 25th, 2014. While I could have you here for hours telling you how substance use affected me and everyone around me, I will focus predominantly on how stigma has affected me and why we should combat it. I was raised by a young mother who altogether ended up having 5 fantastic children and is a wonderful example of a human. We had the help of my grandparents along the way and a stepdad or stepmom here and there. My family is a very tight-knit family, but unfortunately my mother suffered from alcohol use disorder, as well as basically every other parental figure I had in my life. Add in like poverty, traumatizing events, and moving around a lot. It was a little unstable growing up. In total, I've lived in 7 states and went to 13 different schools, K through 10th grade, which is when I dropped out. I suffered from mental illness and later substance use issues as a teen, and always felt an outsider by the kids at school and a bad kid by the staff. When I was living in Missouri at 14, I was once handed a pill by a girl after PE class in the locker room. She went through and just handed, everybody a pill. I didn't know what it was, and I threw it away, and I just kind of turned around and tossed it, because you don't want to be not cool or whatever. But I had never really taken pills at that point in my life and didn't know what it was. A little later, I was pulled into the principal's office, and there was kind of a bunch of us in there. And they asked me, about the pill situation. And I explained that, I did have it, but I threw it away because I didn't know what it was. And the principal said, "So you did have it in your hand at one point?" And I said, "Well, yes." And I was arrested at, 13 or 14. And I was put into a juvenile facility where you are in a cell by yourself for 23 hours a day. Because that is the protocol in that district. And I was there for 2 weeks, which doesn't seem like a long time, but it's a really long time to be by yourself in that situation. I felt labeled. I felt that I had actually done the right thing in that situation, and because of that label, they didn't take me seriously. I don't think that outcome was really helpful to anyone, including my family, let alone rehabilitative. I had experience with substances sporadically throughout my teen years, predominantly marijuana and alcohol, but a few months after having my first and only child, I tried meth. My self-esteem at that time was at its lowest. I had dropped out, gotten pregnant by a person who had no interest in being with me, and was obnoxiously unfaithful. I was alone with my wonderful child a majority of the time. I wasn't extremely close with my family at that period, and I was working as a waitress both at first shift and bar rush on the weekends. I only say these things to try to explain that there are often a lot of unseen precursors to making the decision to try a substance. I thought, wow, when I use this, I'm working extra shifts, and I still can come home and clean the house and take care of my kid, and it seemed actually kind of like a miracle, But then, of course, things got really unmanageable before long. I was arrested for possession of marijuana sometime early in 2010. With that information, my child's father was able to get temporary full custody of my kiddo. I took my son to daycare and went to work, and when I got there, I was served by, the people, whoever the people are that serve those things, and was told, I couldn't pick up my kid that day. And in fact, that I couldn't see my kid until I responded to the petition, which at 18 years old, I didn't even know what that meant. And I'm not saying to you whether someone who has used substances should or should not be around children, but I had my child every moment, except for when I was at work up until that point, which was almost a year, and then I was suddenly told that I could not see him. It was really traumatizing, and I was not given any recourse. There was no, here's how you can fix it. There's no, if you do this, or support or suggestions. And actually, Jason reminded me that when that happened, I was also evicted from my low-income housing because you cannot have a drug possession charge and get low-income housing. So it was like another time that I was denied respect and education and help due to the use of substances. Fortunately or unfortunately, I started getting in legal trouble right at age 18. On one hand, I had access to treatment in a way that those that don't have supervision like that don't have access to. But in both cases, one can almost never feel ready to get help and actually get it in the same time period. I was sent to treatment several times over the years by my corrections officers, and every time saved my life. Sorry. At least for a while. I cannot tell you the number of times that I was homeless, without food, without money, withdrawing and calling any treatment center in the state to see if anybody would take me, which is, not how it works, unfortunately. I found out when you start working in the treatment field, it's a little more complex than that. Most of us in my situation did not have phone service, so our only option was to try and find free Wi-Fi to be able to contact really anybody. Imagine the girl I described earlier, young, very skinny, roughed up, no money, walking into McDonald's or Taco Bell just to try to use their internet. The judgment one feels, the lack of empathy, and that, ma'am, if you're not going to buy anything, you can't stay here. It is not often as simple as a Google search to get help. Most of us don't have money, insurance, connections, transportation, or knowledge of what steps to take to get help. One of the many times I was in jail, I actually was in a physical altercation, which landed me in a cell by myself. This was at the dungeon, the old jail, for any of you that are familiar with that, okay? Well, one evening, I had a knock at the cell door, which is, pretty uncommon. If you're in jail, nobody really knocks, And someone said, "Are you decent?" And so I said I was. The person at the door worked for the sheriff department in some capacity. He had brought his teenage niece in because she had gotten into some trouble, and he wanted to show her that if she kept it up, she would be like me. He essentially wanted me to scare her straight without me having any knowledge that this was something that was going to be happening. I did speak with the girl, but I was hysterical after they left. They sought me out to show a girl what not to end up like. I felt really hopeless at that point because it seemed like it was already too late for me to fix things. I was probably 19 then. I once had an injury due to a domestic issue, which led to a head injury. I had never had a head injury like this before, so I went to the emergency room because, I don't have insurance. They weren't very concerned with it, which is fine because, I don't know, I'm not a doctor, But I heard staff in the hallway say, "I'm guessing she is just homeless and wanting to get out of the heat." I'd like to mention that, like Jason said, getting a job with a criminal record, being on probation, or having to miss time due to responsibilities for probation is really difficult because of the stigma of having substance use disorder. This example is both structural and self-stigma. I didn't feel qualified for a well-paying job with benefits, and I wasn't getting hired at entry-level jobs either. While recovery is not linear and there is never a guarantee, consider knowing there's a substance use issue in the community and the difference between someone using substances that's not on probation working at your facility and someone who is on probation working at your facility, because the latter actually, doesn't have the accountability somebody on probation would have. It is actually a positive rather than a negative. The problem with stigma is that it prevents those from getting help or support, that need it. It can be internalized so much that those who want to get help feel like they don't deserve it. Or when they do get help, it can affect the quality of services they receive. I tried many times to clean up, to fix things, to do better, and I felt I must just be destined to be this way because I really just couldn't pull it off. I tried to stop using all the time, thinking I could maybe just drink alcohol because, that's more socially acceptable. Or maybe I could just use on the weekends. If I just stay home and don't go around anybody, then I should be able to abstain, which would mean that I'm a special kind of human who does not need the human connection we all need for survival. Never in this period of my life, really from 13 years old on, did I ever know to think about why I was so uncomfortable in my natural state, why I couldn't stand to just be myself. I did not know about recovery support groups. I did not know how to get to treatment without it being court-ordered. I spent several years homeless, in jail, in treatment, and some blocks of time in recovery. Reducing stigma means we can take a community approach to help people that are in similar situations as I was in. I was lucky that although I thought, along with many others, that I was a lost cause, a few didn't think I was, and they held fast and helped me. Otherwise, I wouldn't be here today. Imagine if we could all be that support for people. If we treat people who use drugs as valuable people, and we continue as a community to openly have these conversations and education, imagine how many lives we could not only save, but enrich. Thank you.
Thank you, Anna, for that powerful personal story on your experiences with stigma. What I'd like to do now is direct our attention back to our question: what do you feel holds people back from getting help with substance misuse? It looks like some of the bigger answers right now are fear and stigma. I see insurance up there, guilt, money, shame, denial of their issues, lack of services, consequences, distrust. Pretty powerful answers, pretty powerful question. I'd like to encourage you to scan the QR code that you received on the cards when you came in and to take the survey when you have a chance for us. We also have blank slips of paper that you can write questions on for our panelists that we will do a question and answer session at the end. If you could take a couple of minutes so we've gotten a lot of information, and I want to take a couple of minutes just to kind of turn to your neighbor, left, right, doesn't matter, and just kind of unpack some of the things that you've heard and just kind of talk about what's on your mind and what you're thinking right now. If we just take a couple minutes to do that. And Seth, I'll count on you to give me a thumbs up when it's been a couple minutes. Awesome. All right, thank you for taking some time to unpack what you've heard and learned so far. And now I'd like to welcome Officer Trevor Nobbs to the podium to share his experience with us on how policy ties our hands.
Hey guys, I just wanted to once again reiterate to Anna how thankful I am for her sharing her story. It's absolutely incredible to hear that. That's what I was talking to her about during that little intermission we had there. Even though I am on the law enforcement side of things, to hear somebody's full story through there, and you get bits and pieces as you deal with people, but to hear that full story and hear how events culminate was absolutely incredible. So again, thank you. I wanted to thank all of you guys for coming out tonight. It is absolutely incredible to see the community come together, show support, and empower those around them. As was said, I am Crisis Officer Trevor Nobbs at the Police Department. I have worked with the police department since January of 2019, and I have been the lead on the crisis response team since its start in April of this year. Now, I wanted to create the crisis response team after I got involved with the community and I saw people that were struggling to break a cycle addiction or get help with their mental state. Oftentimes in those sorts of situations, the solution would be to effect an arrest, transport to the hospital or maybe Horizons, and until we received another 911 call, we wouldn't have any more contact with them. But by developing the crisis response team, we can now follow up with individuals and ensure continued support. That's basically what we're talking about here. Hearing these stories, you hear that people feel like they don't have that support system in place, and that's really what our team is striving to do. My topic today is how a policy will tie our hands in certain responses, and there are definitely cases where it does. However, one of the benefits of developing a brand new team is that as we grow, our policies and our procedures can grow as well. We can develop new ways of interacting and helping the community as we shape our actions and our responses. The case where policy does dictate what we do comes from a safety mindset. People are often hesitant to talk to me as a police officer. They would rather just talk to my co-responder with Horizons, which I completely get. If I had a choice, I'd rather talk to him too. But for his safety, for their safety, for my safety, I do have to stay in the room. We are normally able to get around that by establishing that I'm there for their continued support. My role is not to effect an arrest, take someone to jail, and wash my hands of it saying I'm done. My role is to ensure that they have that continued support and that they have access to the resources here in Hutchinson that will enable them to lift themselves up. There are, of course, a lot of hurdles that we are overcoming as we are a new team and we're growing, the biggest of which is probably the release of information. The policies and laws that protect a person's personal information are necessary. They make sure that private information stays private. But they do hinder our team in knowing about traumatic events and when those struggles are coming. Too often, we see a cycle where someone will start getting on their feet, bettering themselves, and then a traumatic event will happen or a series of traumatic events will happen, which knocks them back down. Our team ensures that when that traumatic event happens, we're standing by their side to help hold them up. As many of you guys know, and the topic today, the stigma that surrounds mental health and addiction, though, makes it very difficult to reach out for help. It can be difficult to reach out to people you trust, let alone a team that works out of the police department. Our hope is that by working with Horizons, by working with Mirror, we will create a friendly, welcoming environment that doesn't last just a day or a week or a month. It'll last much longer than that. We have people in the community that we've been working with since its start in April, so about 3 months, and I have no doubt that we will continue working with them to ensure their continued support. I do have to admit, when I received the topic of how a policy can tie our hands, I was a little taken back. Structural stigma, from my side of things, wasn't something that I had a lot of experience with. Hearing everyone talk, it makes perfect sense, but it wasn't something that I personally had ever experienced. It really threw me. It is true that policy does dictate what we do, but the fact that we have leadership that has given us the freedom to look at our practices and our policies and change how we respond, we've been given a major chance here within law enforcement to change and grow. Our emphasis anymore, my team's emphasis, the crisis response team emphasis, is listening and collaboration. Now, that listening, of course, includes the community in all its aspects, every single person within the community. We welcome input. With this being a new team, the more minds we have working together on this, the better. It's one of the reasons that I wanted to be involved as a panelist and be involved with these meetings. So I would encourage all of you to please stop by, get to know our team, talk to us, and let us know how we can better help you and our community. Thank you.
Thank you, Officer Nobbs, and thank you for all the work that you're doing on the crisis response team. Up next, I would like to welcome Heath Beekler to the podium as he discusses practical ways to rethink stigma.
I definitely want to thank everybody for coming out tonight and giving us the opportunity to share information with you that we deal with all the time. My name's Heath Beekler. I actually grew up here in Hutchinson, Kansas, and started my 27-year career in substance abuse treatment right here with Mirror as a third shift tech. I got the opportunity to learn from the ground up what addiction was all about, and especially the treatment of addiction. Became a counselor, and for 5 years worked directly with patients that struggled with the disease of alcoholism and addiction. You know, my topic tonight is specifically about practical ways to overcome stigma. There was a lot, and I definitely thank everybody so far, you know, for providing a lot of very rich information about what stigma is and how we can combat it on an institutional level. But I'm actually really interested in what you all think about addiction, what the stigma is that exists publicly and individually, because that's where the practical change has to start. You know, Jason mentioned the disease of addiction, and there's been a lot of challenges to the concept that alcoholism and addiction is a disease, because after all, it's actually using alcohol or drugs as a choice, right? Well, I would say it is. At the same time, you know, there are a lot of diseases associated with smoking. A lot of those terminal, like addiction. There's also heart disease as a result of overeating, a sedentary lifestyle. There's a lot of different ways that disease affects people because of the decisions that it is that they make. And it's not easy to change. It really isn't. And so with addiction, you know, just like, let's say, lung cancer or emphysema, or heart disease, high cholesterol, you know, it's not the behavior that it is that we attribute the disease. It's the process in the body. So let's say that I am living a sedentary lifestyle, I'm overeating, I'm just not taking care of myself, and as a result I wind up getting heart disease. The behavior that I'm engaging in affects that organ. That organ doesn't work right at that point. It's not as efficient, it's not as effective. It is causing additional problems in my life. The outcome, if left untreated, could be very, very detrimental, can't it? It can even be fatal. As a smoker, the behavior of smoking, we know has a lot of negative effects on the organ that is our lungs. Our lungs do not work right. They're not as effective. They're not as efficient. Can cause a lot of different problems, and if left untreated, you get the picture. Addiction, alcohol use, substance use, drug abuse affects a lot of different organs, but primarily the brain. Every decision that it is that we make, every thought that it is that we have, every emotion that it is that goes through us, now is affected by the substances that it is that we're using on the basis of the behavior. And if left untreated, leads to a variety of different problems in our lives. So I'm going to challenge you tonight. The two things that I'm going to wind up leaving with you is, one, let's start rethinking the disease of addiction, shall we? Because if somebody's on alcohol and drugs, we know that they're not thinking right. But at the same time, even when they're sober, the brain has been affected profoundly in the ways that it thinks, how it thinks, the priorities that it is that it has, and the decisions that it is that it makes. The further somebody gets away from their last use, the better their brain has to be resilient and recover from those kinds of issues. But then secondarily, there's a lot of times when we wind up, we ask the question about addicts, what's wrong with you? Ever had that asked of you? Maybe in, not so kind terms, right? But we say, well, what's wrong with them? What's wrong with them that regardless of the consequences, regardless of the risks, regardless of the pain and the heartache and the problems that it is that they cause, why can't they change? Well, when you wind up hearing stories like Anna's, and you wind up hearing the background, you hear the history, you hear the pain, you hear the problems, you hear that there's nowhere to turn, can you blame her for having turned to alcohol and drugs? So I'm going to charge you with the next time you wind up thinking, what's wrong with them? Ask the question, what must have happened to them? Because we can choose the narrative in our minds as to whether or not this person is somebody that we should view with disdain because they're an alcoholic or an addict, or we can think, what must have happened to them that drove them to that point? You can also ask yourself, what would have had to happen to you to drive you to that same point? I'll be like Jason and not tell a whole bunch of stories, but there's one specific story that is very pivotal to me in my life. As I wound up growing up in this community, I graduated Hutch High 1989. That year was a very, very heartbreaking year for me as I wound up experiencing the suicide of a very, very close childhood friend. I wasn't prepared to deal with that. I mean, who is? My parents weren't prepared to deal with that. What parent is? As a result, I very well could have been an alcoholic and an addict because who in the world knew where to turn when you're experiencing that level of pain? Luckily, my parents had some resources and they were able to get me connected with Horizons. And a counselor there helped me work through it. At the same time, I wasn't perfect. My friends, a lot of them turned to drugs and alcohol. I could have very well easily have done that as well. Can't say that I didn't on a couple occasions. My mom and dad are in the audience tonight. Sorry, guys. But I had a supportive family. I had a loving family that didn't judge me for the decisions that it is that I was making. How many people like Anna, how many people like Jason have those same kind of supportive families? Not so much. So rethink what's wrong with them. Ask yourself, what must have happened to them? Thank you.
Thank you, Heath, for that speech on how to rethink and change the way we approach stigma. I'd like to take another moment to direct our attention up here to our first question of the evening. Seth, are we wanting to switch over to the second question now as we're getting deeper into the panelists? We have, you can log back into menti.com. You can use this code 86344149. What do you feel can move people forward in getting help? So if you want to log into that and you want to answer that with a word that you choose, I think that would be great. Also, we've heard a lot of information just over those last two speakers, and I think it'd be good for us to take a couple minutes and turn to our neighbors and just kind of go over what's on your mind and unpack what you've heard and what you're thinking. And please feel free to come forward and grab a blank slip if you'd like to write your question down rather than be a part of the open mic. There will be an open mic after all of our speakers, all of our panelists. Also, don't forget that you have the QR code that you can get online and you can fill out our survey as well. So just take a couple minutes now and unpack what you've heard so far, please. All right, everyone, thank you so much for taking the time to unpack some of the things that you've heard this evening. I'd like to welcome the Honorable Judge McCarville to the podium to speak on how drug court helps reduce the stigma.
Thanks very much. I'm honored to be here tonight. I'm really appreciate everybody coming out. As I was listening to the other speakers, I was thinking, how did I get into this? And a couple things occurred to me, and like some sayings, that before I ever got involved in a drug court, I learned a few things about life and problems. And I spent a couple decades or more representing people in divorce cases, and I realized that people don't want to be divorced. They don't only get divorced because the pain of staying in their relationship is too much, and they need to get out for their own psychological and or financial health. And it doesn't do any good to spend any time in that divorce case trying to figure out whose fault it is, because my saying, I would offer many times, are we going to fix the blame or are we going to fix the problem? And during those same couple of decades, I was representing people in the bankruptcies and the consumer debtor bankruptcy work. And there's many reasons people end up in bankruptcy. I remember one of my first clients he was self-employed. He ran a big piece of construction equipment, and the construction business went in the ditch, and he had no jobs and no money and had to let his health insurance go, and his wife had a heart attack, and he got a $50,000 bill for the hospital, but she was alive. And there was no way he's going to be able to pay that or actually ever get back on his feet again. Other people got themselves into bankruptcy by spending foolishly, just like the people that get in heart disease because they eat too much. But it doesn't do any good to fix the blame. You got to fix the problem. And that gets me back to drug court. We can spend a lot of time trying to figure out who caused this problem, whose fault it is that this person has a substance use disorder, or we can try to fix the problem. And it's a lot easier to be successful if you value the person and fix the problem. So what is drug court? I'm not sure. I think a lot of people here know what drug court is, but it's kind of misleading in name. I kind of call it an accountability court because we expect people to do a lot more things than just stop using drugs. I like to talk about the 3 reasons we have a drug court. One is that we save a lot of taxpayer money from not having to incarcerate people, probably like $9 saved for every dollar we spend in drug court. We save people's lives because those folks were doomed to a lifetime of incarceration and addiction and probably death. And we make the community safer. When I first got involved, I was thinking and talking to people about, there's this myth that if people really want to do treatment, it'll be successful, and if they don't, then it won't, and we just have to wait for them to be motivated. And what I learned was that how successful a person is in recovery has most to do with how long they stay in treatment. So I would tell people, I can make them stay in treatment because if they don't go to treatment, I can put them in jail. That was before I learned that putting them in jail really wasn't that much of an effect. It didn't help that much. It really sometimes did more harm than good. But we do try to keep people in treatment for a long time and hopefully get them to the point where they can be successful. We find that there's problems when we talk about stigma. A lot of the folks that we see are so down on themselves. I mean, they're personally embrace the stigma that it's hard to get them to realize that maybe it would work. Just give us a chance to help you, and you can be successful, because they've been so unsuccessful so many times over so many years, and being beaten down and shamed because of that. we try to provide some things to help overcome that. In other words, if the stigma's holding them back, we try to provide a little leverage, like, okay, if you don't participate in treatment, we're gonna have to sanction you. If you do participate in treatment, we can give you some rewards, and what we reward them with depends upon the person. But we've learned that positive reinforcement is like 4 to 5 times as effective as negative sanctions. And we try, as we developed our drug court, as a team, we learned a lot of things about trauma-informed treatment, about how the language we use. We try not to talk about dirty UAs and clean UAs. We talk about positive and negative. We try to not ask people, well, what's wrong with you? More like, what can we do to help you? We try to recognize the fact that most of the participants we have in our drug court have a treatable mental illness. We try to get them screened for that so they can get the treatment, because sometimes that is a barrier to treatment for the drug addiction. A lot of people have acute childhood experiences, ACEs, that are, really terrible life experiences that really interfere with them. And we also try to learn about the science, like we were talking about here. Heath was talking about, well, maybe it was Heath, I think it was, or maybe Derek here, medically assisted treatment. We see a lot of resistance to that. Probably some of that is the structural stigma that prevents treatment providers from prescribing the drugs that we need to have people prescribed, and a lot of it has to do with funding of that, because some of these drugs are not very affordable for most people, and we work through a lot of obstacles trying to figure out how we can fund a person being able to be provided the treatments that they need. We try to educate ourselves, like for each participant we have, that person may need a certain style of treatment. Maybe this treatment provider has the wrong style. Maybe this one needs the kind of the boot camp drill instructor type of treatment, and the other one maybe needs Mary Poppins. Well, if you put the person that needs Mary Poppins in with the boot camp drill instructor, it's not going to work too good. And also intensity and duration. And so those are the things that we kind of have learned about. And a lot of it has to do with our attitudes and stuff. I remember I was at at a judicial conference one time, and one of my colleagues said, well, if I have it, it'll be a cold day in hell when I ever praise or reward somebody for doing what we expect them to do. And I said, well, you can never be a drug court judge then, because that's what we try to do. And we try to set up things for people to do so we can catch them doing good, so we can give them positive reinforcement. I don't want to take too much time here because I want to leave some for Maddie. But our drug court has changed over the last 10 years. I think we've rewritten our manual at least 3 or 4 times, and as we've learned things, and as the science has changed, and we do things differently. Some things we do based upon what resources we have in the community, and we have a lot more now than we did 10 years ago. In fact, like most of what we have now did not exist 10 years ago. We had some substance use disorder treatment. We had a little bit of mental health, and we didn't have much in the terms of helping people get jobs, teaching them the soft job skills like how to show up for a job, how to interview for a job, and getting them trained so they can actually do jobs. Things like transportation, housing, and all of those things have been barriers for people to be able to be successful in treatment. And we work in those every day, trying to overcome those obstacles and those barriers so people can be successful in treatment. But I think that the key is for everybody in our drug court team, and I think we do this, is value the participants we have in our drug court. Sometimes we have to discharge somebody, we have to kick them out of drug court, and it's sad when we have to do that. It's hard to do that, and the only way we can justify it is to realize that this person we've given them everything we can, and we need to actually take a chance on devoting those resources to somebody else that we might be able to help. But for the most part, we've been successful, and really are proud of our graduates and what they continue to contribute to our community. So I'm not sure that's what you needed to hear, but that's what I have to say.
Thank you, Judge McCarville, and thank you for the amazing work that you guys do through drug court. I know for myself, when I first heard of it, it was a terrifying thing to hear. But once you realize the good work that they're doing with and for people in recovery that want to make a change, it's really awesome to see. I would like to welcome Maddie Bennett to the podium as she speaks on Recovery Capital.
Didn't fall on my face on the way up here, so that's a good start. My name is Maddie Bennett. I am the clinical care manager at the Substance Abuse Center of Kansas Crossover Recovery Center here in Hutch. I also work with Judge McCarville and Kim Paulson, who I thought I saw out there, on Reno County Drug Court. Lastly, I'm a person in long-term recovery. What that means to me is that I have not used drugs or alcohol since December 15th of 2010. Thank you. The other thing that means to me is that I now contribute to the community that I chose to recover in a positive way, including getting up here and doing things that make me really nervous, like speaking. So, for those of you who were here at the last event, you had the opportunity to hear several powerful personal stories regarding the impact of stigma. You heard one today in Miss Anna. Tonight I want to speak to you about the role of stigma in creating barriers which further impact an individual's ability to initiate the recovery process. I want to start with some figures that are going to put things into perspective, and this kind of piggybacks off of what Jason talked about earlier. So a study conducted by Johns Hopkins Bloomberg School of Public Health in 2014 indicated that 90% of people are unwilling to have a person with substance use marry into their family. Only 22% of people are willing to work with someone who has substance misuse. 54% believe that landlords should be allowed to deny housing to a person with substance misuse. And a whopping 43% were opposed to giving individuals with substance misuse equivalent health insurance benefits to those of the general public. This isn't just stigma, this is discrimination. So in essence, stigma about substance misuse impacts individuals' ability to maintain support systems, find safe housing, obtain employment, locate resources, and find, afford, and engage in treatment. With no other medical condition do we stigmatize individuals to the same degree. One thing I want to look at tonight is the misconception regarding the treatment of those with substance use, the idea of rock bottom. Generally, the phrase hitting rock bottom has been used to mean when someone with substance misuse reaches the point where they have lost everything, that nothing could possibly get any worse, and they become willing and open to change. Historically, this perspective has been that an individual will not seek to change or implement change until they hit bottom, that intervention is pointless until they do. Add to the idea that rock bottom is subjective for each and every person. Therefore, one person's rock bottom may be their spouse or significant other leaving them, while another person's is learning they have advanced liver disease. For others, rock bottom is often death. It is a problematic concept to expect that the person with substance misuse must suffer enough to become amenable to change. Contrast this with any other health condition. We do not take a wait and suffer approach with heart disease. We consider this a treatable condition, and treatment is initiated immediately. We do not stigmatize people with heart disease and refuse them employment, housing, treatment, or insurance to cover the cost of treatment. The physician does not ask the patient if they have suffered enough, with shortness of breath or chest pains prior to initiating treatment. We do not ask the individual if they have hit rock bottom yet and are willing to implement lifestyle changes, including diet and exercise, or to take medication to reduce cholesterol or blood pressure. We also do not consider heart disease a moral failing or a criminal problem. We recognize it as a medical condition despite the fact it also contains elements of choice. In part, we do not adopt this approach to heart disease because we know without treatment, often including lifestyle change, heart disease is eventually fatal. The reality is that substance misuse is also fatal. 15 overdose fatalities in our community alone since October 2020. Substance misuse, like heart disease, is not only preventable, but treatable. However, barriers to treatment initiation are substantially greater for most people with substance misuse, due in part to the ongoing belief that people with substance misuse will not change until they have suffered enough, and to the stigma surrounding it. So I want to introduce a concept to you. This is where the community comes in. This is the concept of recovery capital. So this was introduced by William White and William Cloud. So simply defined, recovery capital means the resources, both internal and external, that an individual can draw upon to initiate and sustain recovery. Recovery capital can further be divided into three elements. One is personal recovery capital, which encompasses those things such as basic needs, the individual's physical health, their financial assets, their health insurance, safe and recovery-conducive housing, educational and vocational skills, food, clothing, and access to transportation. The second kind of recovery capital is family or social recovery capital. This encompasses intimate relationships, your family support, and the social relationships you have with friends. Finally, most importantly, community recovery capital encompasses community attitudes, the policies we adopt towards this population, and the resources we allocate and make available to substance misuse and recovery. So at this point, I think we have to state that our community has made great strides in the past 10 years in this area. We have multiple recovery supportive housing options, Oxford House in particular. We have the introduction of the Reno County Drug Court, which just celebrated its anniversary. We have increased treatment providers, including medication-assisted treatment, and the recent opening of a dedicated social detox residential treatment center. However, there is still work to be done. Research indicates, in contrast to the concept of rock bottom, recovery capital, both its quantity and quality, is what plays a major role in individuals with substance misuse achieving and sustaining recovery. Like Judge just said, positive reinforcement works a heck of a lot better than consequences. Increases in recovery capital can spark turning points that end use, trigger recovery initiation, that decision to get sober and stay sober. It can elevate our ability to cope, and it can enhance our quality of life. This is, again, in direct contrast to the idea that additional pain, suffering, or losses will encourage change. Gains, rather than losses, support treatment efforts and healthy lifestyle changes. Most importantly, long-term recovery outcomes for those of us with the most severe substance misuse may have more to do with family and community recovery capital than the attributes of individuals or a particular treatment protocol. In other words, this community and our response to individuals with substance misuse plays a key role in long-term recovery and success outcomes. The concept of recovery capital is logical. Simply stated, the more resources and community support an individual has, the better the outcome. If an individual is struggling with meeting basic needs for shelter, food, and clothing, primary focus will center on meeting those needs to the exclusion of other less immediate needs, such as changing substance use. We as a community can serve a major role in reducing stigmatizing attitudes and beliefs regarding substance misuse, increasing our openness to interact with, employ, and rent to individuals with substance misuse, and increasing community supports for individuals with substance misuse. The power we have as a community to increase successful recovery outcomes by reducing stigma, increasing inclusion, and treating substance misuse as a community mental health problem rather than a criminal or shameful issue can't be overstated. Thank you.
Thank you, Maddie, for that powerful presentation on recovery capital. I know in my own experience that the positive reinforcement works so much better. And not just from my friends and my family, but like you said, from the community, from people outside of even the recovery community, but in the public, and it's powerful. Before we get into the question and answer portion of our evening, I want to encourage you to become a part of the Reno Recovery Collaborative. By show of hands, how many of you have learned something tonight that you didn't know previous? You know, if you want to take that knowledge and become a part of the collaborative, please take a card from the table in the lobby with contact information on it and join us on Tuesday the 20th at noon for our next meeting. We would definitely welcome any and all. As we do begin the question and answer part of our evening, please direct your attention once again to the screen behind me. Continue to log in answers as you'd like, and to the question of what do you feel can move people forward in getting help? And it's a stark contrast to what we saw before. It's compassion and support, it's trust, it's open-mindedness, it's understanding, it's education, it's love. There are things that we see up there on that screen that all of us want to feel ourselves, right? And when we convey this to others, it helps them move towards the solution instead of sitting in the problem. Do we have any paper questions? Any paper questions? No. Okay. All right. This will be the open mic part of the evening. If we have anyone that has any questions, please feel free to step up to the microphones and ask our panelists questions. No? No questions? Okay.
I wrote it down. I'm not a very big speaker, but what could we do for the individuals that need the recovery that has passed by, like inmates that are incarcerated and getting long-term sentencing and not ever being offered the opportunity to have treatment of any sort? Like there's 4 that I know of right now, and that's Richard Warren, Scott Lutz, Matthew Hufford, and Matthew Barnes. And I'm pretty sure there's plenty more, I just don't know.
I couldn't hear. Can you speak more directly in the mic? Oh, yeah. All right, thank you. Her question is, what can we do for other individuals that the recovery movement has passed by? Examples, Richard Warren, Matthew Burns, Matthew Hufford, Scott Lutz, and many more unknown individuals. What can we do for them besides incarcerating them?
All right, so I recognize a lot of those names that you mentioned, ma'am. Part of the reason that our team is being developed, and I haven't interacted with any of those individuals since being on this team. However, our team is more than happy to anybody who wants services and wants help. We are more than willing to work with them, try and get them connected. We have connections with Horizons, with Mirror. We know a lot of the groups here in town that would be able to help, and we are kind of advocates for them more than anything. I mentioned that my role is no longer to arrest somebody, take them to jail, and wash my hands. My role really is to advocate for people. and get them those services. And I realize that it sounds like these services have passed over some of these people. If somebody wants help, I am so compassionate for people that want help. We will get them hooked up with services if they want to. I'm going to put my cards out on a table in the front lobby. Anybody here, if you guys want to reach out to me, I can't always promise I'll answer my phone, but I will always respond to an email. More than happy to help out anybody in the community that needs it and get them hooked up with the services they want.
Also, I try to get them all to write in their own words, what they wanted to say here as well. Because Richard Warren is my husband.
Okay.
And, we have 7 kids all together. And he wrote a letter stating, he does have a bed opening for New Chance in Dodge City on July 28th, but his bond's so high we can't even get him out.
Okay.
So if you would like to read that, because I'm writing it.
That's an excellent question. I'm not 100% sure. I will read that. Thank you, ma'am.
And I also wanted to mention that there, has been a lot of discussion on policy changes and advocacy that, needs to happen, has been happening. There's unfortunately, we can't always go back, right, and redo things or try things over. Sometimes people are in situations where they are seen as more than a drug addict, but also a criminal, rather than a drug addict who commits crimes, right? And so, unfortunately, I don't have the ability to, bust anybody out of prison and get them into treatment. But I can share from my own experience that the last time that I was incarcerated, with the help of others and having that support, that recovery capital that Maddie was talking about, I started doing certain things during that time that would kind of start changes in my thinking and behaviors. I don't want to be too graphic, but I didn't trade anybody's night meds, right, in jail. I didn't snort coffee, which is a thing that has happened in jail. I started actually working steps because I had a woman that was kind enough to come and see me at the jail. Not everybody has the privileges that I have had. But I do know that there are a lot of people in the recovery community that would be willing to reach out or meet with people that are incarcerated, whether it's via letter or video call or in person, to kind of help them, start making the changes they are capable of making within that system. The prison system I could talk for hours about the overhauling of that, okay? That's a different conversation. But we can still actually develop that recovery capital while people are incarcerated. If we can, work on, coming to the collaborative would be great because it would be a great opportunity to see who can be those people for people, right? Who can be those people? Because then you can call your husband or your friend or your brother or your mom and say, hey, I got this phone number for you. I got this person's going to write you a letter and try to, connect with you to start building that capital. So I don't know if that's helpful, but I just wanted to share that.
Thank you, Anna. Are there any other questions for the mic?
I really feel like I would like to respond to that. I'm Trevor's partner on the co-response team, and I will say that it doesn't help you now, but hearing your story as I talk to you out there and hearing your courage to come up to the mic here about how you feel the system has failed you, it hits me right here. Yeah. Yeah. And it gives me reason to push forward with what we need to do. And what Trevor was talking about up here, about the needed change that we now have. I mean, the momentum that's going on right now in healthcare is collaboration, integrated care, holistic. And we are trying to change the system. And hearing these stories gives us, and hearing the success stories, hearing people that have overcome, gives us the strength and the inspiration that we need to say, yes, we need to change this. Yes, we can do this. So thank you.
Thank you. Absolutely. If you didn't use today, if you didn't pick up today, then that's a success story, like that is. You have a question?
So we talked a lot about policies. So what are the best ways that if someone wants to change a policy or wants to get involved in that type of work, what can someone do?
Well, I mean, are we talking workplace? Are we talking county? Are we talking state, federal, et cetera? There's a lot of options. I would say, number one, join the collaborative if you have interest in kind of trying to figure out things. There's a lot of people that have had experience. You know, we've had actually people from drug court who, you know, I don't know, a couple years ago did a chamber lunch to kind of try to talk to employers and say, hey, listen, you know, you really need to hire our people and here's why. So if you're like, my work doesn't handle this very well, okay, then you can ask around, how did other people do it? If I'm interested in policy, I will research policies of other states that are similar in demographics to ours, or more rural areas and how they've implemented things. You know, talking to, you know, your legislators, your senators, about things, you know, you can, a lot of them, you can email, you can call them. I only know a couple legislators, but they tell me they appreciate a phone call from their constituents and say, hey, this is something I'm really struggling with. There's a lot of people actually that do a lot of work behind the scenes to try to implement change in this community. And so you can get involved with that and connect with those people at the collaborative meeting would probably be the easiest way to find those connections. But yeah, I mean, there's a lot of us that are, you know, able to kind of help direct some of that work and have experience in trying to change policies, you know, small and big.
Right. So you're saying anyone here could have a part in changing policy?
Absolutely.
Okay. And then I got a second one, and this is probably going to be geared towards Maddie. So we talk about policies. That means we're obviously getting into a little bit of political stuff, right? So with recovery capital and some of the things that we're talking about there and how it adds support to individuals gaining long-term recovery, could it be said that recovery capital could also lead to improvement of infrastructure to a community or even a fiscal benefits?
Absolutely. When you're looking at the community level as far as recovery capital goes, that is exactly what you're talking about. That's the policies that we adopt. That's the resources we make available. That's the contact we have with people, and that goes clear down to prevention. Because if we're catching, I mean, the vast majority of people that wind up with a substance use disorder in any given year began using before the age of 15. So we're looking at even targeting adolescent clients with this recovery capital, intervening early before it becomes a problem later on.
Awesome. So,
did that answer your question?
Totally. So anybody here can have a part in changing policy, and it could end up improving our communities financially even.
Well, and one thing I want to add to that is look at the number of people at this table right now and just in this room that are in long-term recovery. We as a group freely give back what was given to us. We are some of the best people to have on your team. We give back what was given, and that's part of what helps us sustain long-term recovery. So we are an awesome, talented, amazing, giving group of people, if given the chance to do so.
And not going anywhere, right?
I just thought of a couple of things, that are policy things that folks here could help put pressure on the people that are controlling these things to do for us. For example, employers, if people out there in the community that are employing people, they give them a drug test before they hire them, and that's it. In drug court, we test them frequent, random, and observed. We have really good drug tests. So hire our drug court participants because they're clean. The other people that you're hiring, you knew they were clean on one day. Ours are clean every day. We have a hard time. I've been working for years to try to get the Department of Corrections to adequately fund community corrections, so we have enough community corrections officers, some intensive supervision officers, to really provide the services we need for our participants. Because that being like Kim Paulson here, she sees a lot of people, and they're really needy people. They need a lot of services. They don't just check in once a month. Oh yeah, I still have my job. They have a lot of problems that have to be worked on, and she spends many, many hours every day doing that. And the Department of Corrections and our legislature doesn't seem to understand that those few dollars that they allocate to fund people like Kim Paulson saves them way, way, way more in terms of the cost of building more prisons and hiring guards who really don't do much more than warehouse the people in the prisons. I'm sorry if I hurt anybody guards' feelings. Likewise, we scramble around for grant money here and there, nickels and dimes, to put together enough money to pay for a defense attorney. We have to have a defense attorney. And actually, people that are charged with felonies are entitled to have an attorney represent them. But our Board of Indigent Defense Services in Topeka, they barely fund the Public Defender's Office, and we've had a hard time, zero success, in getting them to allocate an attorney to help us in the drug court. So they need to recognize that that's the responsibility of our community. Our state has a responsibility to pay for that, but they're not paying for that. I know that we're asking our county commission to help fund more positions in community corrections. That's to help people be responsible citizens and not victimize our community, and also to save the lives of those people. So those are just things that you talk to these people. If you go to church with them or shop with them, whatever. As you go around the corner and you run into Paul Wagner, you can just tell him, I really think that you should provide state funding for drug court. I think you should provide more funding for community corrections officers. I think you should provide more funding for criminal defense attorneys. And explain to him why that's important to you as a citizen.
Okay, so my name's Gary. I'm an addict, and I actually graduated drug court, so this question's for drug court. So I got lucky being able to get drug court because luckily I was only ever charged with possession. Has there ever been talk of people that have been charged with distribution not automatically being disqualified from drug court? Because, as an addict, a long time, I had to sell drugs to feed my addiction, so I wasn't really a drug dealer. I want to know if that's ever been talked about or if that's possible to be a policy change.
Yeah, that's been talked about. And if I was really smart, I would be able to tell exactly who we should allow into drug court and who we shouldn't be letting into the drug court. The danger is if you have somebody that's distributing drugs and they're primarily a drug dealer, we just provided them a whole bunch of customers, and it ruins lots of lives. We are, I think, at least enlightened enough to realize that almost every single addict shares their drugs with somebody. So that technically, if you talk to Mr. Stanton, the district attorney, that's distribution, and that is a serious felony. But when we screen people, we don't screen people out just because they're involved in that. But we don't know enough to really know exactly where that line is. I wish we knew that much.
Thank you. Go ahead.
Yeah, there's been quite a bit of discussion regarding comparisons between other diseases and the disease of addiction. And I think most people in the community, when they hear about a heart attack or cancer or lung disease, they can kind of understand that. But when they think about the disease of addiction, it's like, I mean, I'm a recovering addict, and I don't understand it. You know, I mean, I know it works in the brain, and it makes you do things you don't want to do, but I guess my question is there any plan to try to educate the public on how addiction is a disease? You know, how does it work on the brain? You know, and make people aware of what this stuff does to people. And
Well, Ted, you know, I'll take this, but I think somebody else is probably more qualified. You know, I'm a Vietnam vet, and a lot of Vietnam vets, a lot of combat vets end up with post-traumatic stress disorder. I think I'm normal. We'll find out. I'll talk to my wife later. But anyway, and you know, for years and years, I wondered, okay, how am I so lucky to not have that? And these other guys, because I don't know that they did anything really wrong, but from what I understand about PTSD, it's kind of like tennis elbow. You know, it's like an inflammatory disease. You injure a little micro injury, and micro injury, and then pretty soon you never like get that thing to calm down and not be inflamed. I know that there's some people that experience like a serious super trauma, but a lot of us experience trauma, and we somehow manage to be lucky enough not to do that. I don't blame the people with PTSD for getting PTSD. They didn't do anything. And I think that probably people that are suffer from addiction didn't, you know, it's hard to identify, okay, where did this start? It's kind of like the Princess and the Pea, or my analogy to like, fix the blame or fix the problem. It doesn't really do you any good to fix the blame because it doesn't solve the problem, and we really need to solve the problems. I think we're going to be struggling for years and years, hopefully not too many years, but for people to come around to the idea that addiction is a disease. I was talking to Lori the other day, and I remember one of my drug court conference trainings, we were talking about brain science and all the chemicals involved and the pathways and all of that, and it came to me that the similarity between an addict needing their drug and a person who is drowning needing their oxygen. In your brain, you have really finely tuned sensor that detects the slightest drop in the level of oxygen in your blood. And when that drops, you have to get some air. And if I told Heath here, I said, Heath, here's the deal. Hold your breath underwater for 5 minutes, and I'll give you $10,000. And he thinks that's a good deal, you know, because Navy SEALs can do that. But I guarantee you that about 90 seconds into it, Heath will not remember anything about my promise of $10,000. Every single cell in his brain will be telling him he has to get some air. And I've come to understand that's what happens to addicts, and they have to get that drug, and it doesn't matter who they hurt, their family, their friends, their community, they're going to do that. And most people don't understand that how addiction works, you know, how that it works in the brain, or how it affects people, or how it actually takes over control. So we got a ways to go getting people educated about what addiction is and how it works.
I definitely can follow up with that, and thank you for equating me with the even the possibility of having the lung capacity of a Navy SEAL, let alone the psychological stability. So, you know, that is a very good question. You know, that there needs to be a lot more public knowledge about the disease of addiction. You know, Jason had actually mentioned earlier that really there's not been nearly as much funding to researching addiction and especially the effects of alcohol and drugs on the central nervous system, in particular the brain and the different lobes. As more and more funding has been attributed to it, we know more and more. One of the things that I think is the most important thing is for all of us that do know and understand it, help to reframe it for people that don't. You know, again, you know, if somebody winds up having lung cancer, even if it's as a result of them smoking, people have empathy for that. They didn't ask, to come down with lung cancer. People with heart disease did not ask to come down with heart disease. Nobody winds up growing up as a child wanting to become an alcoholic or an addict, right? And so if we wind up not only having that empathy individually, but help to logically and rationally reframe it for others, I think that's where we can wind up having the biggest impact.
Thanks. I'd also like to say that what we're doing here tonight is exactly how you get this out into the public with this new knowledge. This is what you do, right? We have a discussion. We have information given to us. There is no doubt that addiction is a disease, right? That has been proven. That is a fact. That's not something up for debate. You go home and you talk to your family, you talk to your friends, and I challenge you, I call to action, I challenge you to come back on August 13th. Bring friends with you. Let's fill this auditorium. There's no reason why we shouldn't, because it's affecting everyone in our community. I have a question for the audience. Stand up if you are a person who has suffered from substance use disorder. Yeah. So please stand up if someone you love has suffered from substance use disorder. Now stand up if someone you know has suffered from substance use disorder. This is our community. If we want to do something about it, then we have to do something about it. We don't have to wait for our legislators to do it. We have to beckon to them and tell them that we want change. That's how it works. It isn't that we wait for them to change their minds. It's that we say we have the power, we are the people, and we want their minds to be changed because we want policies changed. That's how this works. We do it. Sorry to cut you off.
No,
Go
you're
ahead.
fine. I'm Dakota Bowman. I think I have a question more for you. You briefly talked about working with adolescents. I know that's something that I've thought about quite a bit lately. I know that when I started using drugs, every adult told me what was going to happen, and it didn't set in my mind like it would have if somebody my age now would have talked to me then. And, I don't use drugs anymore. But that's something that I would love to do, is to work with youth before it becomes a problem like it did for me. And I was wondering if there's anything already in place like that, or...
Actually, someone from Anna may be better served answering this as far as the work, Communities That Care, is that?
Rise up,
Okay, I'm gonna pass this down to Anna so that she can talk about that a little bit more.
So the meeting that, we've all been talking about, the Reno Recovery Collaborative, which will be on Zoom on the 20th, but hopefully if you guys complete the survey, it'll have your email and we'll send you out the link. Carla right there is the person that you can talk to about working with youth. They have a coalition, a prevention coalition. So there is, like I said, lots of people doing the work. That's why the collaborative is such a good place, because there's all these different subcommittees and different people that come to the table. So it's a way to connect the community with what everybody's doing, and so you can figure out, where you fit or where your interests are in helping in this community. So, Carla? Yeah.
Thank you. Ooh, that was loud. Thank you for coming up and asking. That's brave, and I appreciate that. And I am going to get a hold of you, and we are going to have you talk to other kids and younger kids, and I would love for you to do that. So I'll just make a shameless plug here. I'm Carla Smith, the director at Rise Up Reno Prevention Collaborative. Hopefully you've heard lots of our commercials and seen some of our advertisements around just trying to really encourage parents to help their kids be strong and have the resilience and the capital they need to prepare themselves to make good choices and hopefully avoid ever getting into a situation that they don't know how to get out of. So our job is prevention, and we definitely work a lot with high school kids who are making good choices, and they get together and they go come up with research, and they work on policies. They got the smoking areas implemented at the state fair. They've done some policies to kind of try to prepare the city and the county for when marijuana is legalized eventually. We want to make sure that there's some resources in place to keep it from being readily available next door to schools and those types of things. So we do have a lot of things going on. We do have a prevention coalition that meets once a month, and I would invite any of you who are interested in that to maybe just write prevention by your name, or let me know. Our cards are out there, and it's Rise Up Reno, so I would love to get you involved if you're looking to be involved in prevention, and especially if you're looking to be involved with kids. That's our neck of the woods. But I would also like to say, amazing panel tonight, amazing. This was a wealth of information. I feel like you guys just had a broad variety of things to share, and I appreciate that so much. So I hope everybody will come join the collaborative, because I just would love to see this keep spreading. So great job.
Thanks, Kelly.
I want to answer the young man that said that he would like to give back and influence people his age. People with fancy degrees like to think they change the world, but sorry. The fact is that plenty of studies have shown that peer support is powerful, and it's more powerful than almost anything for someone suffering PTSD, drug addiction, or mental. Horizons hires people for peer support, and we are always looking for good peer support workers. And in fact, you can work at Horizons in peer support, and you can do that long enough, a period, I don't recall exactly what the period is, and demonstrate that you're good with that, and be essentially given credit for having a bachelor's degree in social work, and be able to move up into a position that is equivalent to that. So, because we recognize the power of a peer and someone else who has overcome.
Thank you. Are there any other questions for our panelists tonight? Look, this affects our entire community. Question?
Yes.
Go ahead.
Hello. Do you believe that destigmatizing substance abuse would help, catch people before they hit their proverbial rock bottom with drug abuse?
Well, I would definitely think so, primarily because, because of stigma, people don't want to actually admit that they're having a problem, whether that be to loved ones, to their employer, or otherwise. And then plus, the potential ramifications, the potential consequences of actually coming out and actually saying those things. If we wind up actually reducing or eliminating stigma, it removes that psychological barrier to decision making. Even if they're affected by substances. I mean, I think fear was one of the word cloud items on there. Fear is a huge driver of decision making, and so if you wind up eradicating that, if you wind up reducing it to a manageable level, people can wind up getting a lot more help, a lot easier, a lot quicker, without having to go through some of the pain that it is that we see a lot of people go through before they finally get help.
That's just a proud dad moment. That's my son, so. He's 16, that's super brave. I've been nervous up here all night. He just walks up to the mic and asks a question. That's amazing to me. This affects our entire community. It's going to take all of us to make the change in how we approach and communicate about this disease. I want to ask you all to take this back to your homes, to talk to your neighbors, talk to your friends. Join the collaborative. Join us on Tuesday at noon so that we can get to know each other and we can see what we can do as a community. I'd like to thank our panelists once again for sharing all their information and the stories. If we just give them a round of applause. I'd like to ask you to join us again on August 13th at 7 p.m. for our third session. And I'd just like to thank you, the audience, for coming out tonight. We appreciate you. Thank you.